Scar is considered one of the evilest Disney villains in the history of the franchise. His major atrocities include the murder of his brother, the attempted murder of his nephew, authoritarian leadership over the Pride Lands, and the manipulation and exploitation of the hyenas. The analysis of his character has led to the conclusion that Scar has an antisocial personality disorder, ASPD. This essay aims to explore this psychological disorder through Scar's actions and understand the possible ways of treatment for ASPD. ASPD is a very complex disorder described by a person's inability to socialize properly in the context of cultural and societal norms, which is why it is considered a personality disorder. According to Huffman et al., people with this personality disorder are typically egocentric and exhibit a lack of conscience, remorse, or empathy for others. Traits such as manipulativeness, narcissism, and a willingness to exploit others for personal gain are hallmarks of ASPD. People with this disorder are often described as sociopaths or psychopaths because many famous people with ASPD include serial killers, such as Jeffrey Dahmer, Ted Bundy, and Charles Manson. This trend sadly leads to the stigmatization of this disorder and the association of it with violence and criminality. Scar exhibits such behavior throughout the movie, The Lion King. His main motivation is power and control over the Pride Lands, which led him to commit various moral crimes. He feels no remorse over killing his older brother Mufasa and cruelly deceiving young Simba in order to achieve his goals. People with ASPD often act impulsively, meaning they can inflict pain and suffering on others. This inability to control one's urges, coupled with a lack of empathy towards others and dismissiveness of ethical and moral standards, can lead to violence. However, most people with ASPD do not strictly use violence to achieve their goals. Manipulation, impulsive lying, and exploiting the weaknesses and fears of others is typically the way most individuals with ASPD inflict harm on others. Scar also shows these traits in his interactions with the other characters. He manipulates the hyenas and forms an army with their forces while promising them bountiful prey, although he is never shown to care about his followers. After his young nephew discovers the body of Mufasa, Scar tells him that he is at fault for his father's death. He strategically uses deceit in order to force him to flee and abandon the throne, exhibiting manipulative traits of ASPD. People with ASPD are shown to be very socially sophisticated and have a kind demeanor. Huffman et al. Write that people with antisocial personalities can be charming and persuasive, and they often have remarkably good insight into the needs and weaknesses of other people. Despite all of the terrible things that Scar has done, he is still considered to be a very likable and charismatic character. He has a very charming way of speaking, a mysterious and endearing demeanor, and a sense of humor, though he never seems to enjoy the jokes he makes. His ability to force kindness is what allows him to gain his young nephew's trust. In terms of treatment, it is very difficult to help people with ASPD for a number of reasons. Van den Bosch et al. Highlight the stigma associated with ASPD because of negative misconceptions about the disorder. Besides the preconceptions, research has shown that people can be genetically predisposed to ASPD, making it even more difficult to treat. Generally, research on the type of interventions for this disorder is scarce. However, certain therapy types are used in treatment. Specific instructions for treating ASPD are described in a study of therapeutic interventions. Van den Bosch et al. Explain the three components of therapy: preconditions of the environment around the therapy sessions, the treatment staff, and the therapy itself. The environment must account for the stigma people with ASPD face, which means it must be non-punitive, comfortable, and negotiated. The patient and therapist must share a framework for crossing behavior, such as aggression and substance use or abuse. The treatment staff must eliminate preconceived notions about their client to ensure an unprejudiced attitude. Cognitive and behavioral therapy that focuses on impulsivity, interpersonal problems, and antisocial behavior, among others, such as reasoning and rehabilitation and enhanced thinking skills, is promoted as treatment. This type of therapy is focused on combating intrusive thoughts and impulsive actions, helping individuals with ASPD recognize and limit harmful behaviors toward themselves and others. In conclusion, ASPD is a personality disorder that is very difficult to treat because of severe misconceptions that people with this disorder are violent. However, there is a psychological explanation for a predisposition towards harmful and manipulative behavior in individuals with ASPD. A character that exhibits certain traits of the disorder is Scar from The Lion King. Scar's lack of remorse and empathy, a charming yet deceitful attitude, and strategic manipulation techniques are all characteristics that fit into the description of ASPD. Therapy for patients with this personality disorder must be in a safe and unbiased environment with trained specialists who can administer cognitive behavioral therapy focusing on antisocial tendencies. You can find this and many other essay samples on our website, studycorgi.com.